Hello and welcome to Healthy India. I'm your host, Dr. Alaric. And this is a program in which we try and address all health issues that concern you and me. As the last week of April is observed as World Immunization Day, it becomes pertinent for us to talk to experts who can help us understand the significance of vaccination and immunization. So this is what we'll be talking about today. To tell us more on the issue, I have in the studio three eminent doctors. I'm very happy to welcome Dr. N.K. Arora, who's the Executive Director of INCLIN. So thank you so much for joining us. Sitting next to him is Dr. V.K. Paul, who is the Professor and Head of the Department of Pediatrics at the AIIMS. So thanks for coming here. And we are also joined by Dr. Arvind Seri, who's the Director, Professor and Head of the Department of Neonatology at the Kalavati Saran Hospital. So thanks for joining us today. Well, friends, before we start and talk about immunization and vaccination programs in the country, let's all take a look at this report.
Immunization is a way of protecting the human body against infectious diseases through vaccination. Immunization prepares our bodies to fight against diseases in case we come into contact with them in the future. Babies are born with some natural immunity which they get from their mother and through breastfeeding. This gradually wears off as the baby's own immune system starts to develop. Having your child immunized gives extra protection against illnesses which can kill. The schedule recommends that the vaccinations should start when the baby is 1.5 months old. Even if the baby is brought late for vaccinations, she should still receive all the vaccinations. While it is the best to follow the ideal immunization schedule, on no account should the baby be denied vaccinations, even if she is brought late for them. But every attempt must be made to complete full immunization before the age of 1 year. India's immunization program is one of the largest in the world in terms of quantities of vaccines used, numbers of beneficiaries, number of immunization sessions organized, and the geographical area covered. Under the immunization program, vaccines are used to protect children and pregnant mothers against 6 diseases which include tuberculosis, diphtheria, pertussis, polio, measles and tetanus. The hepatitis B vaccine is also included in the universal immunization program in a phased manner. A few infants and children may develop allergic reactions after the vaccination, but most of these may be normal. A doctor must be contacted for proper care and treatment. With proper and timely vaccination, your child will grow up to be a healthy adult.
Well, now let's try and understand as to what is this program really all about. So, Dr. Arora, if I were to begin with you, this year's theme is a very interesting one. It says, are you up to date? So this is the theme for this year's Immunization Week. So I would want you to tell us and the public here as to what is this immunization program all about and when did it really start and what are the kind of results that you all are seeing now?
Immunization, as rightly said in the film just now, that when a child is born, it has some protection available from the mother and the breast milk. But this is a child who is naive in terms of susceptibility to infection. And child can get all kinds of very serious infections. And many of them are potentially life-threatening. And it is to counter this susceptibility and vulnerability of a child, of a newborn and the infant in the first year, that this immunization program has come in. We are all aware that chickenpox was, smallpox was such a big dreaded disease, and it has been eradicated just through this immunization program, and it used to kill not only children but adults also. But today we have got a excellent immunization program, and when we say to make it up to date means that we need to reach the last child, every child in this community who is susceptible and must be protected against diseases. And today the menu of vaccines, the variety of vaccines which are available is pretty big. It is beyond 6 vaccines. Today we have vaccines not only against tuberculosis, polio, diphtheria, tetanus, pertussis and measles. We have vaccines for pneumonia in terms of H influenza B, and now in the country we have pentavalent vaccine which is gradually being expanded to other different parts of the country. Then a new vaccine for diarrhea has coming, which is rotavirus vaccine. We have pneumococcal vaccine. We have meningococcal vaccine. So a very large number of vaccines now are available to protect our children. And it is particularly important from Indian perspective because India in absolute numbers loses a very large number of infants and newborns.
True.
And vaccines have a very big role. Over last 20 years or so, vaccines have saved millions of children.
Okay.
And this program was started in true earnest in 1978. And today it is a nationwide program where almost 80% of the children are covered.
True. So, Dr. Paul, it is a very successful program if we really look at it. But which are the pockets which you all find very difficult to penetrate even today?
Ultimately, every child, 2.5 million children, must be reached with all the vaccines, starting with birth and then through the first year and into the second year in particular. The pockets where we do not reach are the pockets that belong to the poor people. So the communities, backward classes, scheduled caste communities, tribal areas, the urban poor, parents are working, awareness issues are there. Then there are difficult to reach districts themselves, which are very spread out. So that is where the real challenges come.
That's true. True.
We need to reach all of them because those are the very most pronounced in terms of their susceptibility and the need, because vaccines kill, and vaccines related illnesses that vaccines that are trying to protect are killer diseases like measles, for example. And it is very important that we reach every child, and they also lead to undernutrition and other problems. So we need to reach everybody. And those are the pockets which are difficult to reach, but that's the real challenge for public health.
True. So, Dr. Sally, do you think that we need more tangible programs probably to kind of cushion the one which is already there? And also, since we have, the WHO has said that now we are polio free. So, if there are still pockets which are a challenge, so what does it really mean? Are those children really immunized, and are they given polio drops at all? Or, I mean, how does the common person really understand that?
The bottom line is that we can actually do it. We've shown it that we've done it in polio eradication. We've done that.
Right.
Once we went into a campaign mode, we did it. So I think we can do it. The program is pretty okay. But the only thing is there has to be the will to do it. And if we have the will to do it, we can reach the sky, I think. So I don't think that another program is required. The program is fine, but we have to do it, and we have to be very dedicated in doing whatever we're thinking in terms of doing.
So do you think that the awareness campaigns are fine, the ones which are running, or do we need to do still a bit more in that regard?
Well, yes, awareness wise, yeah, I think we can do a little better than what we have already done in terms of awareness. Yeah, because advocacy is one thing, awareness is another thing, and we are into that advocacy mode as well. So we have done it, and I think the polio is a fantastic example of the way we have gone about, and we can, I think, eradicate the other diseases as well.
That's right. That's right. So, Dr. Arora, now if we were to talk about this whole program per se, how does the moment a woman is pregnant, does her vaccination of some kind begin at that time, or is it only once she has delivered a baby?
In fact, you have raised a very interesting question, and this is the talk of the global immunization community at the moment. We know in this country, during the pregnancy, women are given tetanus toxoid, 2 injections, and which protects the newborn from tetanus. And I must say almost 60-70% of the country now neonatal tetanus, the tetanus which affects the newborn, is eliminated.
Right,
and it's a matter of pride. And I think by 2015, this country should be able to eliminate all neonatal tetanus. So immunizing mother is a great strategy. Now recently, the evidence has come which shows that if we immunize the mother against influenza, the first 3 to 6 months, a lot of new children lose their lives because of severe influenza infection, and they can be protected by maternal influenza vaccine.
Right.
Another experiment which is going on, and very good trials are going on, that during pregnancy, if we immunize the mother with pertussis vaccine, then during the newborn period, we can protect the children. So maternal immunization is a great strategy, and just like breast milk is important to protect, mother's own, when the baby is growing up, she can also be a route of immunizing and protecting the child in the child's initial 2 or 3 months.
Right. So, Dr. Paul, but how difficult or easy is it really to convince the mothers? Because this may be something very new. So I'm sure, again, the challenge does lie ahead. How do you all tackle that?
I think there is a great degree of acceptance for immunization, because this is not something which is new.
Correct.
And people have seen success with smallpox. You know, the whole 2-3 generations have seen this. So the resistance to immunization is, I would say, selective and small. It's a matter of us reaching and convincing the last person. And sometimes there are issues like, can I immunize a child who is relatively unwell, has a little fever, little cough, difficulty to reach out an immunization session. I don't think it's a very major issue, but certainly people do have occasional concerns about vaccines. After all, these are injections, and sometimes there are issues around that. For polio, we had to surmount some peculiar resistance from specific groups, because there were, misunderstandings about it. But that's the duty of the health system. But I think something which must be stated here, partly also a corrective to the film, the documentation that was made, is mother receives tetanus toxoid vaccine, which protects her and the baby, as Dr. Arora said. But at birth and the first day and before discharge from the facility, or the first possible contact in the community, is the first opportunity for vaccination.
Okay.
And the vaccine that the baby, every child should receive soon after birth, before discharge, is the BCG vaccine. That comes at birth. The oral polio vaccine, the so-called 0 dose, and also the hepatitis B, which is the liver damage causing virus. So these 3 vaccines are given soon after birth. So the real vaccination program starts soon after birth. Then it is 6 weeks, 10 weeks and 11 weeks.
Right. We'll talk about that in a bit detail too.
But it's important to recognize that we start quite early.
Quite early, that's right. So I think the point here is that people must ensure that they only go for institutionalized deliveries, because once the mother is in a hospital, then these vaccines can really be given to the child, because they may be missed if the deliveries are happening at home. Well, it's time for us to slip into a very short break. When we come back, we'll be talking about the details of these vaccines, as to which vaccine should be given at which time, and if a child develops fever as a result of some vaccination or the other, then what is to be done. So don't go away, as we are coming back in just a moment. Welcome back. This is Healthy India, and today we are talking about the importance of immunization and vaccination. Now, Dr. Arvind, I think it would be a good idea to tell the people, as I just said, that institutionalized deliveries are really important and they must be taken up seriously. Now, after those 3, suppose in case if a delivery has happened at home and those 3 vaccines are missed, then what is the road ahead?
We talk in terms of the first opportunity when you vaccinate the child. It really means that if you have missed out on the vaccination at birth, then the moment the child is there, start the vaccination right then. And that depends on what is the age. I mean, if we are talking in terms of the younger age group, when the baby is just about a month or so, then of course you start right from the beginning, where you have the dose 0, and then you start with the first dose and the second and third dose. So it's got to be the opportunity missed, and we have to take care of the opportunity which is missed. We take care of that. So the vaccination can be started any time, but if the child is bigger, larger child or older children, then you have to change the schedule a little bit.
Okay.
So that we can discuss it out, but that schedule has to be changed. But in the initial stages, till 5 years, then simply have the same schedule, which can start it off right from the beginning, where we have it in the newborn period.
Right. And also sometimes children develop fever after certain vaccinations. So, and that sometimes really scares the people, the mother especially, and she thinks that it is because of the vaccine that my child is ill now. So how does a doctor explain this?
There are 2 issues in this. One is the pain which is caused because of the vaccination. And there are vaccines which have come up which will reduce the pain, the duration is less, the pain is less. And the second bit is about the fever. And each of these are treatable causes, treatable reasons. For instance, if there is pain, then you can even give paracetamol, and even for the reasons of fever, the baby can be given paracetamol, which will take care of it. But before that, you can even undo the pain by either giving the breast milk to the child or giving something sweet. So the child, the immediate pain which is there because of the vaccination itself is taken care of.
Okay.
So these are issues which can be tackled out, and I don't think they should be detrimental in terms of the vaccination program per se. So one should continue with them, and the fever can be taken care of.
Right. So Dr. Arora, now talking of the vaccines, how are these timed as to which month which vaccination is to be given, and what is the result of giving that vaccine?
I think we are discussing this issue of schedule of vaccines,
yes.
And it is imperative for our parents that they should remember this. Giving the vaccine at the right time ensures that child is optimally protected. Because if we delay it, if we do not follow the schedule, the vaccine efficacy is not affected, but we leave the child vulnerable to infection during the period when the child is not immunized.
Right. Okay.
So at birth, the vaccines, so if the child is born in an institution or even when the child is at home, and if we inform the A&M or the doctor, the vaccine can be given in first 48, 72 hours. And that is hepatitis B, BCG and polio 0 dose. Then at 6 weeks, 10 weeks and 14 weeks, these are three first primary doses where we give today in the country a vaccine called pentavalent vaccine, which has 5 vaccines. The first vaccine is pertussis, which is kali khansi or whooping cough. The second is tetanus, then diphtheria, hepatitis B, and then H influenza B, which protects against meningitis and pneumonia. So this pentavalent is given. In some states, pentavalent is still not started. There DPT is to be given. And along with every dose, polio, oral polio is to be given. Then at 9 months, measles first dose is given. Now it has been seen that unless 2 doses of measles are given, it's not completely protective. So 2 doses so first dose is given at 9 months, and then subsequently another dose is given around 15 to 18 months, or if there is a campaign of measles going on, and you give that. Now the point which is very important, that many times we miss out a vaccine. So for example, I have given my child at 6 weeks, I forget at 10 weeks, and then I feel, what do I do? Should I just forget about it? No, doesn't matter. Even if my dose is missed by 4 weeks or 6 weeks, and I give the second dose as 14, and then after 4 weeks I give. So I can always complete my schedule if I have forgotten 1 dose or a second dose. The whole purpose is that my child should get complete schedule or complete doses of all the vaccines which are part of the things. And I can delay it. So many times, and particularly it happens in migrant population.
That's right.
Many of us are not aware. 10% of Indian population at any time is mobile. And as part of the program, immunization program, it has been found out there are 400,000 immunization, these migrant points all over the country. So there is huge migrant population and they miss out. I got my first dose in Azamgarh and then I moved to Mumbai and then miss out. No problem. I go to the clinic, the health center, and start the vaccination program wherever I have left, and so it completes. So it is important that even if I have delayed some doses, it doesn't, I should not stop that and should continue and complete the vaccination program.
Right. Well, so this prompts me to ask you, Dr. Paul, that in case the population is like that, migratory, so sometimes they may not really know as to where to go for vaccination for their children. So where are these vaccines really available? Are these only available in the big hospitals, or are they also available, say, in smaller dispensaries and places like those?
Immunization is primarily for the general public is available through the public health system.
Right.
And certainly not only in the large hospitals. In fact, I would say the largest distribution points of immunization are really firstly in the community itself. So in the rural communities and urban communities, A&M in rural areas and equivalent workers in the urban, peri-urban areas are the ones who hold immunization sessions within the community. So that's one obvious opportunity. Then primary health centers, small dispensaries of the urban health system, and then community health center, district hospital, everywhere. Immunization is the responsibility of the state that flows through every small and big facility, every small and big hospital, and in addition, a major program flows through the community. So the opportunities are tremendous. It's only a matter of connecting with those opportunities. But something which is very important for every child is to have a record of immunization. And this is like a mandatory. It's a very efficient system. So we have a very nice card which is available. So the child who gets the first dose in, say, Kosi in Bihar would have this card, and this card is valid when the child comes to Delhi, for example.
So all over India, that same card is?
That is very important, because then by looking at it, somebody is very sure what has been given, what has been missed, and then also, of course, this card serves the purpose of looking at the weight and so on. Very nice messages. So equally important as remembering what to give is to maintain this card, because this is a record and this is a channel through which we also provide health messages. So I think that's something very important.
That's right. Now, Dr. Saili, I'm sure people who are, say, new parents, they may not really know whether these vaccinations are available for free, or does one really have to pay, say, a minimal amount anywhere that one goes? So what would you want to say on this?
Well, the vaccines which are in the national schedule, they're all available for free.
Okay.
There's no charge on that.
Okay.
But then there's some optional vaccines, which I call them optional, but they are vaccines, every vaccine is good. In the sense that it will protect against...
just tell all about this in detail as to which are the vaccines people who can afford, they must go for.
Absolutely. So there's a schedule which Dr. Arora has talked about, is the National Immunization Schedule, whereby we are giving the vaccines, and there are preventable diseases which are taken care of by these vaccines. But apart from that, this is the DPT, the polio, the measles, the mumps, and all of them. But apart from that, there are certain vaccines which can be given to the people who can afford them. For instance, rotavirus vaccine. Rotavirus vaccine is not available in the government setup.
And what is it for?
So this rotavirus vaccine is for the diarrhea. 40% of diarrheas in children are because of the rotavirus. These are viral diarrheas.
Right.
And then they cause dehydration, and the baby will be severely sick, and then the baby can die as a result. So the protective way will be to give the rotavirus vaccine. And this vaccine also will not be given through is not currently given through the government system. So it comes for a charge. Similarly, we have the vaccine which is varicella vaccine, which is for the chicken pox, against the chicken pox vaccine. That is also comes for a charge. And then we have the hepatitis A vaccine, which also comes for a charge. So similarly, there are a couple of other vaccines, the PCV vaccine and including the pneumococcal vaccine. These are all coming for some amount of money which has to be spent by the parents, and then they are given out. So there are vaccines, and this is again as per the epidemiology of the disease. The epidemiology of the disease feels that there is epidemiologically the disease is very, very rampant. Then the government takes a call, and they will start the vaccination in that particular area, and then they take on the program. For instance, in the hepatitis B vaccine, initially it was not a part of the program. It started off for the simple reason that they found that the epidemiologically the disease was prevalent in a large population of the people. So they started off the vaccine. And there again is a question of logistics come the efficacy. For instance, if we talk in terms of hepatitis B vaccine, the best option will be to start at 0 dose, 1 month, and then 6 months. But in the government of India, we are giving it at 4 weeks, 10 weeks, and then 14 weeks. So that's how it is. So that is the issue. So we have vaccines. They are expensive vaccines as well. But once the need is there and need is felt, and the vaccines start, probably then the cost-benefit ratio will be there, and the cost might come down as well.
Right. So, Dr. Arora, don't you think that if these vaccines are so good that they are available, say, at a price, then why is it that they are not really included in our national program? Don't you think that this should be taken up at a war footing?
Many of the Western countries today have 16 to 18 vaccines during childhood.
Okay.
So there is a large number of vaccines which are considered good, and they are being used in some countries. There are several factors when a new vaccine is to be introduced in the country. One point which Dr. Saili just mentioned is about the burden of disease. How big is the problem?
Yes.
The second issue is, and which is equally important, that its safety and efficacy. How good is the vaccine? Third thing is that is my system ready to introduce the vaccine? See, health system has to have the robustness and the fidelity that if a new vaccine is introduced, whether it is can handle. do we have the sufficient amount of cold chain available, manpower available, and finally, which is very important, is financial issues. What is the cost? So many of the vaccines which are available may be available for almost 2,500 to 3,000 rupees a dose. But if we introduce, the rest of the program will collapse. But I must also say that Indian vaccine manufacturers have done an excellent job.
Okay.
Today, some of the best vaccines are available in India. India, in fact, is the largest vaccine manufacturer. And the vaccines which are available in the developed country for $50 to $100 is available for the same vaccine for $1 in this country. And that is how some of the recently new vaccines are being introduced.
Okay.
So there are several factors which need to be taken into account when the government decides to introduce the vaccine. So there are two sectors. One is public sector, where all these factors have to be taken into account. The other is private sector or the optional sectors, as it was mentioned. But in the optional sectors, it is extremely expensive. So if I have to completely immunize my child with all the available vaccine, it will cost me almost 40 to 50,000 rupees. A man on the street and even a middle class cannot afford.
May not be
And gradually, as the things improve, as the system can take, the vaccines are introduced into the program, and that's how the common man and the larger population benefits.
Will be able to benefit from it. Well, so we can probably just wait for that day when we'll be a little more prosperous, so that we all can immunize our children against all these diseases that all the three panelists here are talking about. Well, folks, it's time for us to slip into yet another break. When we come back, we'll be taking this further, so don't go away, as we'll see you on the other side. Welcome back. You're watching Healthy India, and today we are talking about the significance of immunization and vaccination. Now, Dr. Paul, I have a question here. This is Sumitra Banerjee from Kolkata. She says that after vaccination, she hasn't mentioned which vaccination this is, my child has developed fever. Is it okay, or do I need to take him to a doctor for further medication?
As was stated earlier, several vaccines can produce pain and some level of fever, particularly so with pentavalent or DPT. Originally, it's safe. It's part of.
It's normal too.
It's normal.
Okay.
It's something which is lasts very briefly. One should not really worry about it. And as has been stated, take paracetamol. Often it is given from the same facility who are giving vaccines. So really no cause for concern. One dose or two doses of paracetamol 4 to 6 hours apart should do the trick. Not to worry.
Okay. Now, Dr. Paul, I would want you to stress a little bit upon the fact that, when one goes about reading the news, you find out that sometimes parents would go to these centers, medical centers for vaccination, and sadly the vaccinations are not available. So in such a scenario, what is to be done? First of all, why is it that they have to face these things in the country?
Firstly, uninterrupted vaccine supply in the health system is something which is very important for us to ensure, for the government, for the system to ensure, because then only the faith builds up with the community and the families. So it's something which must be avoided at all costs. And the responsibility lies with the state government, lies with the municipal authorities, or whoever supplies, and also with the hospitals.
Right.
Because every contact that a family and a child makes with the health system, whether it is a small facility or A&M, is expected to be used for giving something as good as a vaccine.
True.
Therefore, there is really very little rationale for stockouts. But yes, it can happen. There can be very genuine reasons. All I would say is then come back. Come back, go to another nearby facility, but don't lose the opportunity to get your child immunized. Go out the next day or the next day, but do not miss the opportunity, because as Dr. Arora very aptly stated in the beginning, the period for which a given vaccine, when it is due, has not been given is a period when this child is vulnerable. And I don't want to see kids being vulnerable to any extent. So we move to another facility, we reach out to another place, or come back to the same place if the stockout is taken care of by the time the child comes back.
And Dr. Sally, sadly, lack of manpower is another issue that one does grapple with on the ground. So when you face these kind of realities, then somehow, you know, your whole faith in this whole program that otherwise people think is running so successfully comes under question.
So the bottom line again would be that we have to have the right manpower, number one. And besides, I mean, I think immunization doesn't require a very large number of manpower.
True.
So you have the ANMs who are working out there. You have even the doctors who can give the vaccine. Vaccine can be given by anybody. There is a method of giving the vaccine so that there is no adverse events. Otherwise, there is no issues in terms of the manpower being impediment in terms of the vaccination program being successful. I don't think that's really the.
So you just mentioned adverse events. What are the kind of adverse events that one would really come across?
Well, adverse events, you know, actually adverse events, they are, I don't think we should hype them too much for the simple reason that will be detrimental to the program per se. But otherwise, adverse events are when any immunization is giving rise to some problem. We could talk in terms of adverse event. In the sense that if the vaccine, there can be adverse events because of the vaccine per se.
Okay.
Say somebody is given a vaccine and the patient gets, say polio vaccine is given and person gets polio. So that's an adverse event because of the vaccine.
Right.
Then there can be adverse event which can be trigger event. Trigger event in the sense that the vaccine has been given and the patient gets a febrile convulsion because he gets fever and he gets a febrile convulsion. It could also be as a result of the injection per se. You've given an injection, the injection has caused the infection thereof, or the injection has not been given very properly and the patient gets an abscess there. So that's because of the injection. So these are the adverse events which can be there, and one has to investigate the adverse events, one has to look into the adverse events and then take care of the adverse events. But then having said that, the government becomes very concerned once there is a death because of the immunization, if there is one. Then that is not because of the vaccine per se, it's because the preservation, the way the vaccine has been carried out, the way the cold chain has been maintained, that's what causes it. So we've had deaths where we talked in terms of staphylococcal infection, which has given rise to the infection and the babies had problem because of the infection. That's not because of the vaccine per se, because of the way the vaccine has been stored. That's the event. So these are some of the adverse events
So
that we're talking about.
in your experience, has there been a particular vaccine as a result of which you have seen these adverse events?
Well, people have talked about vaccines. There are issues, but then they have been proved wrong. For instance, people used to talk in terms of autism, which is associated with a particular vaccine.
Okay.
But that's
Not
found
true.
to be not true.
Okay.
And similarly, the measles vaccine is supposed to be the one where people have had problems in terms of the deaths which have occurred in some of the regions. That was also because of the staphylococcal problem which was there, toxic shock syndrome. So these are the issues, but I don't think it's personally because of the vaccine. If it's given properly, stored properly, the cold chain is maintained properly, then it's a non-event, I would say.
Okay. So is there anything you want to add to that, Dr. Arora?
I would like to see, there is a term called AEFI, adverse events following immunization.
Okay.
Now we need to be clear that many times events take place, but causally it may or may not be related to that. So for example, last evening I had rice and dal, and today morning if I get diarrhea, it doesn't mean rice and dal has given me diarrhea. So with vaccination also something very similar happens.
Okay.
Many times it has happened. It happened recently in one of the states where we investigated that vaccine was given and 3 days later child developed serious fever and pneumonia and meningitis, and it was because of infection. It just happened that temporarily it was associated, there was a vaccine, 24, 48, 72 hours another event happened. And with children are so susceptible and vulnerable, anything can happen. Therefore, even if something like child has to be hospitalized, child dies, one has to do a systematic assessment whether vaccine is related or not. Now the point which Dr. Sally is saying, that one thing which program has to take care, that it is not because of administration of the vaccine. Suddenly what has happened, that 4 or 5 children start getting abscess at the site of injection. Clear the person who is giving injection is not taking care that the needle is sterile. As a result, local abscess starts occurring. And these are program errors, and the program has to take care. And that is why a very extensive program is on to see that one has to pick up and minimize or eliminate these program errors. But almost all the vaccines which are currently in the program are very safe, and no serious association has been found whether in terms of death or so. Yes, fever is also an adverse event. Like with DPT, fever is very common. Almost 60 to 70% children get fever and local tenderness, which is a mild adverse event. It is associated with vaccine and it can be taken care of. But the benefit out of DPT is far outweighing than this mild fever which occurs for few hours after the vaccine. And in fact, all the mothers practically today know that it is a sign that the vaccine has been given and child is protected now. So we need to look at the benefit out of the total thing and minor side effects which may occur to be accepted.
Now, Dr. Arora, there's been a lot of talk recently regarding a vaccine called the HPV vaccine, especially for adolescent girls. So what is this vaccine for and who should it be given to? Which is the right age to do it and does it cost? So many questions in that one question.
So in fact, you have raised another very interesting thing, that all these years we thought that vaccine means child. No, we have to move beyond child. We started with the mother's vaccination, and now gradually we are realizing that we have to have a life course way of vaccination and vaccinating at different ages. HPV vaccine is another very good vaccine. It prevents again cervical cancer or the cancer of the mouth of the womb, cervix. And the virus which causes this can be prevented by this vaccine. And clearly girls have to receive this vaccine and before the infection can occur. So infection can occur because of various reasons, including when women or the girls become sexually active. So most appropriate age for giving this vaccine is between 9 to 14 years. So just before a lot of these events start occurring. And in fact, there is interesting, very recently, just 2 weeks ago, a new WHO guideline has come in that if the vaccine is started at this age, only 2 doses are required. Prior to this, it was thought that 3 doses are sufficient, required. But if we start the vaccination between 9 and 14, only 2 doses are required. At the moment, this vaccine is extremely expensive. I think it costs somewhere around 2,000 rupees or 1,500 rupees per dose. I may be wrong, but it is expensive. But I hope that if this vaccine is manufactured in India, it's locally available, the price will certainly come down. But it is a very useful vaccine. Recently in our country there was a lot of controversy associated with this vaccine, and so now some safety trials, additional safety trials are going on within our country, in other parts of the world also, to ensure that the community, both the lay public as well as scientific community, is convinced about its safety.
Currently, the recommendation is also about 3 doses rather than 2 doses.
Yeah,
no?
it has been reduced to 2 doses just two weeks ago.
So this is a very recent development. All right. Well, for those parents who can afford this vaccine, I think you must go and get your little girls vaccinated for with an HPV vaccine. Well, it's time for us to slip into the last break of the program. When we come back, we'll be talking about a few more things regarding the importance of vaccination and immunization. So don't go away, as we'll see you on the other side. Welcome back. You're watching Healthy India, and today we are talking about the importance of immunization and vaccination. Well, we've just learned that there is a program that is being run by the government, but there are also some vaccines available maybe in the private sector which cost a little bit of money. But those of you who can afford, see to it that your children get vaccinated with those vaccines as well. Now, talking about the HPV vaccine, Dr. Paul, what is the kind of response that you get from people who can afford a vaccine like this? Do they come up with a lot of questions and fears?
I think because it is a new vaccine, the awareness levels are relatively low.
Right.
And there is a genuine concern about some of the trials that happened, and this channel also covered that issue very recently. So it's picking up. It needs explanation, and ultimately I think this will find a place. This is a very interesting vaccine because it prevents a cancer, ultimately, and the commonest cancer in women, one of the 2 commonest cancers in women. So people have questions, but I think the awareness levels are low. It will pick up, and also I hope that the cost will come down, and then it will pick up much more.
True. So what about you, Dr. Saili? What are the kind of experiences that you had on the ground level regarding vaccines like these?
Well, I would say that they are accepted, of course. I mean, it depends again on the kind of population that you're dealing with. When you're dealing with a very low socioeconomic status, they're not really bothered. Then you have to really convince them, and particularly since it costs money, so they would rather not have it. But then when you're talking of the socioeconomic status, which is higher one, they are generally accepted and they go ahead with it. That's our experience.
Now, Dr. Arora, one hears of certain other vaccines also which are given to adults. Now, which are these vaccines and for what kind of adults are they really warranted?
In India, currently, there is another vaccine which is part of the national program, but in a selective manner, and that is Japanese encephalitis vaccine. We have heard a lot of deaths and residual damage to the brain which occurs following encephalitis, particularly in the northern part, spreading through this belt from UP right up to Assam and Northeast India. And particularly it has been seen in Northeast India that adults have been affected by this Japanese encephalitis virus. And now as part of the program, government program, the adults are also being immunized for with Japanese encephalitis. So that is one vaccine which is currently in use for adults. The other vaccine which is for adults is influenza vaccine, and this is to be given every season, and particularly elderly, those who are above 50 years, those who have chronic lung disease, who are smokers, or those who have other debilitating disorders, then this vaccine is useful because it prevents. It has been seen that an elderly, first a viral infection occurs and then they get very severe bacterial superadded infection. So if we can prevent influenza vaccine with influenza virus, then it is a very useful. And in India, there is a very interesting thing which is different from the West. In West, the influenza occurs maximum in winter months, while here it occurs immediately after rainy season. So the vaccine which is to be given is before the rainy. So in March, April, May, the vaccine is to be given. And a third vaccine which in adults is to be given, but which is given only for traveling, is yellow fever vaccine. So if I am traveling to sub-Saharan Africa where yellow fever is epidemic or an endemic, if I am traveling, then I have to get this yellow fever. Again, there are recently there are changes that now yellow fever vaccine is to be, initially it was thought that it was to be given repeated every 10 years, but now only single dose once in lifetime is sufficient, and it takes care of that.
Okay. Now, Dr. Paul, talking about this immunization program, how do you look at the future of this program, and what do you think are the other diseases that we may soon find being covered under this program?
I think two messages. The first message is that there is no doubt that for saving lives of children and also complications in adults, as we heard, vaccines are a very major strategy. It's a pillar of a program in public health sense for the entire world. We have seen that we have eliminated smallpox. We have seen vaccination has eliminated polio. And measles, we are quite close to eliminating in the next few years. Just to give three examples, and diphtheria, whooping cough, each one of these conditions have become, so much less. So it saves lives. So one message to the public is, have faith in this. Have faith in this, and have faith in the fact that when a government allows vaccination to be done, immunization to be done through the public health system, allows its use for people by obtaining it from the market, have faith that we have evaluated this and it is safe, and yes, you have the option to have it, and every child should get the universal immunization coverage. So the second point is really that today every child born in this country must have at least 8 diseases must be protected through vaccination. We talked about 6 original diseases. There are 8 in today's time in the national program. And let me repeat them. BCG for tuberculosis, DPT, which is diphtheria, pertussis, and tetanus. Diphtheria, pertussis is whooping cough, and tetanus, these 3. Hepatitis B for liver infection, which also causes cancer and liver failure. And H influenza B, which is for pneumonia and meningitis. Then we have measles as a part of the vaccination program. So put together, you have 8 diseases which must be protected through vaccination, and that's the right of every child, and it is the responsibility of India's public health program to deliver it. Every opportunity in which the child makes interface with the health system must be used to impart these vaccines as appropriate, and that must happen every nook and corner, and for every population, the migrant and the marginalized. The third aspect is that yes, we are at the cusp of adding new vaccines.
Yes.
Truly so. We added H influenza vaccine just about 2 years ago, and that has become the pentavalent DPT and H influenza and hepatitis B. We are at the cusp of introducing rotavirus vaccine, to which Dr. Sally alluded, which will reduce the incidence of diarrhea, incidence of diarrheal deaths, severe dehydration, hospitalization. So I think we are almost there in very, in a short time, hopefully this should happen, because we have an Indian vaccine which is available at low cost, which is being produced by one of the Indian companies, and that has taken care of the cost and so on. So that's one vaccine which I think is right at the cusp of being introduced in the public health system.
So, Dr. Sally, what do you want to say at the end to the public? What is the take-home message?
We were talking about the vaccines in the adolescents. I think we should highlight 2 more vaccines thereof. One is hepatitis A vaccine, and next one is the typhoid vaccine. This is not really for the adolescents, it can be for anybody.
Okay.
But since these people, they start going to colleges, start going to schools, and they start eating all kinds of things from outside, I think these are 2 important vaccines which one needs to talk about as well. So I think these are 2 vaccines which one must be emphasized on, and they should be had, particularly if the person is going to the hospital or something like that.
Right.
One more vaccine which is again at the cusp is the rubella vaccine. Could be introduced, and some state governments are already have made a part this as a part of their program.
Okay. So at the end, what do you want to say, Dr. Arora?
I would finally make a plea, and I think one feels very good about this issue, and that is, of all the public programs Government of India has, whichever sector we talk about, no other program penetrates the community as much as immunization program. No program reaches 80% of the population. So immunization program is an example of equity. It reaches the highest number of people to the most remotest area. And the target has to be that we must reach 100%.
Absolutely.
We must, next milestone should be 90%, then 95%, and finish it off. And so it is a matter of great pride also that this program shows equity dimension of our public system.
True. Well, on that positive note, I'd like to say thank you to all 3 of you for coming today and for talking about immunization and vaccination. So thank you so much. Well, folks, I hope you got to learn a lot just the way I did. But next week, we'll be talking about asthma and how to take care during asthma. So for that, you must mail all your queries, all your questions to me on this address.
Healthy India, FB 116, Lok Sabha Television, Parliament Library Building, Parliament House, New Delhi 110001. Email healthlstv@gmail.com, and our toll-free number is 1800115314.
Well, as we've learned that our national immunization program is a very successful one, as this is one program that has penetrated the Indian heartland like no other program. But you and I, all of us, need to be aware that we must take every child, because every child has a right to be immunized and vaccinated against a number of diseases that we've talked in this 1 hour. Remember that if you give your children all those vaccinations and immunizations, your child can be sorted to a large extent from a large number of diseases. So it's important, don't get scared if your child develops a fever or something like that, because that is very normal, as our doctors here said. But immunization is really necessary. You must remember that, and try and teach as many people as you can, and take them to the nearest facilities, health facilities, so that these children can be immunized. Well, that's all I have for you this evening. Next week, we'll be talking about asthma and the care that needs to go with it. Well, till then, this is Lottie Alaric saying goodbye, and take very good care of yourselves.